we go on to the second last paper for this session, Cornea 4. So Dr. Jayashree Lilani, clinical outcome of large diameter PK in patients with anterior staphyloma. Are you ready, Dr. Jayashree?
Yes, ma'am.
Please start the timer.
Good afternoon, everyone. Today my topic is clinical outcome of large diameter penetrating keratoplasty in patients with anterior staphyloma. This is not moving.
Please start the timer. What's that? Okay, please go ahead.
Okay, so we all know as acquired anterior staphyloma occurs subsequent to corneal perforation, where iris plugs the wound and forms an ectatic cicatrix, leading to raised IOP and a painful blind eye. So the aim of any surgical intervention in such patients is primarily to achieve tectonic stability, and the secondary outcome is optical. There are different treatment modalities available for such patients, such as penetrating keratoplasty, mushroom grafts, sclerokeratoplasty, dural patches. However, we should counsel the patient that more than one surgical procedure in a stepwise manner may be required. There are several complications such as graft rejection and failure, secondary glaucoma, chronic epithelial defects, expulsive hemorrhage, choroidal hemorrhage, and phthisis. So the purpose of this study was to report the anatomical and functional outcome of patients with anterior staphyloma treated by large diameter penetrating keratoplasty. This was a retrospective study conducted at Cornea Department, SNC Chitrakoot, from January 2016 to December 22. The sample size was 43. The inclusion criteria: patients with anterior staphyloma without any active infection or inflammation were included, and the patients with loss of perception of light, congenital staphyloma, poor ocular surface, or any posterior segment pathology were excluded from the study. The preoperative details included detailed history, best corrected visual acuity, slit lamp biomicroscopy, digital tonometry, and posterior segment evaluation by B-scan. Intraoperatively, host size, graft size were noted, and or any other additional procedure done, such as pupilloplasty or iris repair, were noted. This is the surgical procedure. So peritomy is done using a conjunctival scissor, and a lamellar dissection is done. This further lamellar separation is further carried out using scissors, and then iris is gently peeled off to preserve the iris as much as possible. The anterior cynical lysis is done to release the pus, and then pupilloplasty is done in whichever patient as required. Now the graft is secured, and since there is a crescentic gap, it is filled with a graft scleral patch. So these are the post-operative and pre-operative images of the patient shown in the video. So post-operative evaluation was done at 1 week, 4 weeks, and 3 months. The parameters evaluated were BCVA, IOP, and graft clarity. The primary outcome measured in study was anatomical integrity, in which it was defined as adequate graft-host junction opposition, well-formed anterior chamber, without any graft infiltration, mending, perforation, thinning, or ectasia. And secondary outcome studied was visual acuity. So total 43 patients were included in the study, out of which 28 were male and 15 were female. The most common cause of anterior staphyloma in our study was heel keratitis. All patients had PL positive preoperatively, and on digital tonometry, IOP was raised. Mean donor trepanation was 10.75, and the range was from 9.5 to 12. Cataract extraction was done in 6 patients, and pupilloplasty or iris repair was done in 35 patients. So at 1 week, 100% patients achieved tectonic stability. However, at 1 month, 2 patients developed graft infiltration, and at 3 months, 4 patients developed graft infiltration, along with 1 developed anterior staphyloma. And the IOP was normal in 96% of the patients. At 1 month, 84% had normal IOP, and at the end of 3 months, similarly, 84% patients achieved a normal IOP. So this shows the mean IOP at follow-up, where at 3 months, the mean IOP was 16.75. So BCVA in less than almost 56% patient had BCVA of less than 1/60, and similarly 22% patient had BCVA of more than 660 and more than 1/60. So coming to discussion, penetrating keratoplasty is difficult, but performing such keratoplasty is difficult in anterior staphyloma as due to forward movement of lens and iris diaphragm, and at times lens is strongly adhered to the iris, and so therefore careful dissection is done for salvaging the iris tissue as much as possible. In our case, we did corneal debulking to preserve the maximum iris tissue, and pupilloplasty was done to for anterior segment reconstruction. Similar study was conducted by Manan et al., in which they studied 8 patients and they achieved tectonic stability in all the patients. However, in our study, we had 84% patients achieve tectonic stability at 3 months. These are some other patients in our study. And glaucoma is a common complication seen in such patients due to floppy iris and pars formation. So using oversized graft by 1 mm and pupilloplasty provides an adequate anterior chamber depth. Pupilloplasty helps in forming a round circular pupil, thus preventing pars formation and secondary glaucoma. So coming to conclusion, even though we did not achieve a good visual result, the anatomical function of 84% cases was maintained in our study.
Thank you.
Thank you.
Just on time. Any questions?
Just a comment, because it's a very short-term follow-up you have on these difficult and complex eyes,
Yes,
right?
ma'am.
So it's very hard to make any conclusion from this study. So I suggest a longer-term follow-up.
Yes, ma'am.
All right. Thank you, Dr. Jayashree.